one for Senator Mida. He's asking for a report on the extent of overcrowding and strain at the Mamadusi Kibaki. Outline measures taken by the county government of Nairobi to address overcrowding, and then clarify the steps being taken by patients are not unfairly charged for services they are unable to access due to current constraint. Recommend measures on how the national government and the Ministry of Health can support the county government of Nairobi to improve. I think those, since you have written responses, you can give us just a whole summary overview and just allow senators to ask if there's a specific question they want to deal with.
Thank you, Chair. And Chair, I agree. Now that we'll exhaust all of this, and I want to commend your clerk, Humphrey. He has found a way to be able to communicate better with our county, such that we don't have the backlog that we had before. And so whatever comes to this committee, Mr. Ringera, who was my campus mate, will be able to make sure we dispense with very quickly, Chair. Chair, the issue of detention. Number one, we don't detain women in facilities. It is the waiver period and process that takes a bit of time. And that is what we were refining. Because you find people ultimately, and you've been a governor, facilities cannot run if payment is not made. And that is why we tell people, please register onto SHA. Register onto SHA so that you can be covered. But you see, also keeping them for long is a cost, because you have to feed them. They're taking space others would have taken. But imagine if everybody who says they can't pay is released immediately. All facilities will collapse, Chair. If people had the option of not paying, they will not pay. Even those who can pay. So, Chair, we have a waiver guideline, we have a process of waivers, partial waiver or full waiver, that hospital by hospital we do. Chair, when I go to those hospitals, and the CEOs will tell you, even those who could, all the women, they come running and they say, oh, Governor, tumekwama hapa. Sometimes it is not true. They say there's been there for 3 months. It is not true. I don't waive for them. I pay. The only difference is, Chair, I don't put it on media. And I think people should stop carrying cameras to hospitals. You're going to see someone in a hospital bed, you're there with your camera, you're looking at their leg. It is very indecent. It takes away the decency, of that patient and the dignity of that patient. You must respect their dignity. So, Chair, that's the waiver system we have. We will keep on doing campaigns for health insurance, because health financing is a critical aspect that this country needs. And I'll tell you an example. Today, in my level 2s and 3s, my primary healthcare facilities, I think I will invite you to come to Embakasi South or Embakasi East. You can go to Tasia. We can go to Kwandege, what do you call this? Kware dispensary. Kware is now level 2. All my hospitals have assigned, you walk in and walk out. If you're not registered, we register you there and then. Because PHC fund, imagine that hospital that was just like 2 containers is getting 1.7 million shillings a month at the minimum. The PHC is working perfectly. The problem we have is on the level 4s and 5s because of the SHA reimbursement that is taking a bit of time. But for the lower levels, and many people are also not being told, and I'll ask the SHA team, I think I saw the senator here, the CS here, and the CEO, to explain to people that you don't go directly first to the level 4 or level 5. Because those who go there are the ones who say SHA is not working. Because it is based on a referral system. You start at the lower level, and then you're then guided on where to go to. Those who do that have a seamless experience. I know people who've been paid for 300,000, 400, 180. In fact, the number of harambes that we are being put into for health have actually gone down drastically. So, Chair, on the issue of bed capacity, again, a city of 7 million people, the bed capacity required is tremendous. But I keep telling my CEOs, they have become victims of their success. People are coming to our hospitals because they know that is where they're getting good care. And that is why they're flocking in there. So we're continuing with infrastructure improvement, building more wards, hiring more doctors and nurses, because you must give that care. But the policy is you cannot turn away a patient. If a patient comes, you cannot tell them, no, the beds are full. Please, and that person is maybe even critical, or they're about to give birth. Do you turn them away? You don't. But the turnaround time is high. And And that is why, for us to prevent that, those who have been cleared with are discharged as soon as is possible. We have those infrastructure projects. I have shown you Mutwini, which is going to have a huge bed capacity. Is it 300 or what? What is it? Mutwini? Mutwini, which is Mamarecho Ruto. Mutwini will have 400 bed capacity. Mama Margaret is also big, 425. Mama Lucy, this facility that my senator was talking about, is adding an additional 120. And also there's another 300. So we're expanding. What I would ask for the support that Nairobi County needs. Chair, in the same way, we saw that in education, Nairobi needed affirmative action. That a county like Nairobi from 1992 had no new school built. With 7 million people, had only 210 primary schools. You can compare with your county. You know how many primary schools you had, because my guest of honor on that day was a former MP from Eldoret. Was in Gishu, former Eldoret North MP, who is the president currently. And he said when he was an MP, he had 150 schools in his constituency. Nairobi with 17 constituencies had only 210. The same affirmative, and because of that, they did affirmative action in the budget, added 1 billion every year for 3 years through the members of parliament to build classrooms. It's the same way Nairobi would require affirmative action to increase bed capacity in public hospitals and public hospitals. Beyond that, we'll have the same story of women sharing beds. We increase the number of beds. We cannot turn them away, Chair. Chair, I think that generally covers.
Maybe one question, because I visited Mbagathi and your CEO is here. There's a very big facility that was left by COVID in Mbagathi that was not in use. But CEO, is it in use? Ama wasasa umangoa?
Honorable Chair, it's not in use. We engage the public health sector, and that space has been condemned. But we are putting it into a better use of a center of excellence in maternal and child health.
Okay, Senator Onyonga.
Thank you.
Thank you, Chair. Governor, my question, I don't know whether Chair I'm preempting what you wanted to raise. I'm just interested to know, how has your FIF performance been? Has it been increasing? And in your responses to the questions I've had, which have been asked, I just heard you say the national government is doing this and this. Other than the constructions you've done and the projects that are standing, how much is your FIF helping? And as I said, has it increased? Is there a variance and that kind of thing?
Senator Amida.
Chair, you realize, I think, Nairobi, I think it's long overdue, Chair. I would just propose for us to go for inspection, simply because just to support all that. And you remember, even these questions, actually, I think we haven't seen Gava for some time, because I mean, these were since 2024. But one more thing, Governor, there was a motion that went through, my motion on postpartum depression, I mean having a mental health wings. We've gone to many hospitals, and I think, of course, Nairobi being one of them, that you find mothers who they have lost their babies in the same wing with the ones who are breastfeeding. It's really, they fall through, I mean, they go through depression. So mental health issues, and I said, I'd requested, the postpartum depression who are going through that, can we have a separate wing for them in every, county for them? And then number 2, yes, inspection. Then one last thing, Governor, let's take advantage. I think we've been having even many investors who have been interested to build hospitals. I don't know whether they've approached it. So in case we have, and maybe we have been having many proposals on that, why don't you take advantage? At least the legacy for you in Nairobi is care. Health is wealth.
Yes,
So let's take advantage of that.
Governor, 1 minute response.
Thank you. Chair, I agree. I agree with Senator Hamida and also Senator Onyonka. Number one, we have to be creative. There are many partnerships that we've sought now. We're working with the Swedes or Novo Nordisk guys for the Danish, sorry to their country, on the issue of diabetes, and you'll have a center of excellence. The first research hospital public research hospital is going to be Mbagathi, working in partnership with Kemri, so that even these who are doing great medical research can do their clinicals within our hospitals. Chair, if you look at Mama Lucy, now it has an annex in Umoja that is the first public eye hospital where we're even doing admissions, we're doing surgeries. That had never been done. We're manufacturing the spectacles from there in Umoja too. And I would wish you come see it. There was an old man, and I always give this story, 91-year-old, he had not seen for 50 years. He went to Umoja too when we were launching. We gave them 1 month of all-free services. He regained his sight. And he started saying, I'm not going to leave this hospital. Because he felt if he leaves that fence, the sight will go back. That he's only seeing because he's in there. And you could see him asking his son, Kumbe, you look like this, I thought you're more handsome and whatnot, joking. And there are many such stories. Regaining sight, now you're finding people from all over the country are coming to Umoja too. They know the matatu to take to reach Umoja too because of that eye hospital. I've talked about dental services that we've increased across the county and dental chairs that were never there. Many of us never went to a dentist growing up. We thought that's for rich people, God has helped us that we can still smile, But there's such transformation when you change governance. On PPPs, we're working on one currently in Isili. Isili, we have beautiful land, big space, abandoned facilities. Investors have come and said, look, we want to partner with you. We put up a hospital, public hospital to the level that you want, and allow us also to have our own private wing. It makes sense, We need to do the same for expansion even of the Nairobi funeral home, because the same quality today you're going to get at these private facilities, whether it is Montezuma or whatnot, let me not mention the brands. Today, if you go to Nairobi funeral home, remember the smell that was always at that roundabout. Always. It has improved tremendously. It's called Nairobi funeral home. But formerly known
is the generator working?
Formally, there are many generators. They are working. There's even now a chapel.
Now let's make progress, Governor, because we have one more statement
on the final one.
That's finalized. That's what
FIF. FIF is extremely important. One aspect that I raised, because I called all the facility heads to chat out City Hall, and what one of them mentioned made so much sense that now they have to do accounting work that they were never trained to do, because they have to account for all this money, and we have now been taking them to courses, training them on these financial management skills. There is a no cash policy, so we've sealed the leakage. The FIF has gone up. There is no cash policy. All of it is paid through the system and retained at the facility. That's why I could give you the example of Embakasi South, a small level 2 getting 2 million shillings a month. Now the story of shortage of drugs is a long forgotten story because you have no excuse. And the Wananchi's interaction with the hospital to know whether it's working or not is not whether there's a doctor. They never know whether they see a doctor. Actually, most Wananchi don't see a doctor. They see a clinical officer. If they see someone in a lab coat, that's a doctor, But of course, we have doctors in our facilities. The pudding in healthcare is kama kuna dawa or if there's no medicine. And once that is sorted out, we are seeing the public now, more of them come into our facilities, Chair. Chair, I can leave it at that.
Yes, Senator Onyonka.
Governor Sakaja, if you to listen to what you've said, and I remember I've attended functions, committee meetings where you've sat up like this. I live in Nairobi and I don't know what you've said is true. So is it possible, Chair, if I could make a request that you allow us at least for us to go and verify that what you're saying? Because if this is what you've done, then I don't think we should have much issue.
Senator Onyonka, we don't need the permission of Sakaja to go to any facility.
No, what I'm saying, Chair, is that in case he's going to have the by-elections, you know what I'm saying, he might think we are going to look for votes. So we
Yeah,
just want to visit.
the facilities are spread across
There are 16
Nairobi.
other sub-counties that don't have a by-election.
Yes. Now, members, because we have only one statement from Senator Okiom that I've gone through the statement, and I think we can still dispense with this statement before it is 2:30. I think we shall have cleared our books with the county government of Nairobi. So I'd ask Governor, a statement was sought by Senator Okiom Tata, the senator from Busia, and I have seen the team from Bagadi were here. I think this can be adequately addressed. I've also gone through the responses. There was an allegation of abuse of medical bill waiver facility at Bagadi County Referral Hospital, including involvement of hospital staff management in the said malpractice. Then number two, the veracity of allegations of threats, intimidation against staff and patients and their families, and indicate measures in place to guarantee safety and protection. Then number three is audit of collection of parking fees at the said hospital, determining whether due process was followed in the introduction of the charges and clarify how funds collected are utilized. The mechanisms the Ministry of Health has put in place to monitor and ensure proper administration of medical bill waiver facility in public hospitals across the country. But I think if you reframe that within Nairobi County, you tell us what you are doing about it. And then number five, whether there are regular audits of public hospitals specifying whether Bagati County, I think the rest of the audit we shall deal with the ministry, but we also want to know from the departmental level of your county government, do you do regular audits to your facilities? So I think if we can get those responses, I can see the CEO is already positioned himself, Governor.
Yes, Chair, I'll just give a general overview and the CEO can quickly run through it. Chair, our intention, as I've said, is to enhance autonomy of the hospitals, especially the level 5 going up because of the potential that they have. Chair, a hospital ideally should run itself. If you go to any private hospital, even if the charges are a bit higher, they run itself. Lab is profitable, you know, the issue of medicine, etc. And that is where we're moving to without overcharging the patients. And Mbagathi is one example of a center of excellence in the country. In fact, the CEO has been receiving delegations from other parts of the country to see how certain things are being done, and he can be able to explain that. I think the last team was from, was it Nakuru, on the issue of neonatal ICU. So, Chair, the waiver process has been outlined, and we've given the sample waiver forms and the process that is undertaken to provide the waivers. The issue of intimidation, and we needed more information there. The answer is that the allegations are not true, but the hospital has an anonymous incident reporting system, and we encourage, and that guarantees safety and protection of whistleblowers, including, if something must be escalated at City Hall, there is actually provision to write directly to me, and I'm the only one who opens those letters. No one else opens those boxes. I'm the one who personally goes around to open. The audit of collection of parking fees, whether due process was followed, introduction of charges. Chair, we have two hospitals where we have to introduce parking fees because people would come, leave their cars, and then go to town. And so patients or people who need services don't get, so Mama Lucy Hospital, which now the parking was full throughout, of people who are not seeking services, including even sometimes matatus, previously, as well as Mbagathi Hospital, that has had to be introduced.
Before you leave there, so that because we are short of time. Now, those parking fees you are collecting in Mama Lucy and Bagade, I hope the revenue is going to the hospital.
FIF direct.
FIF.
No, not to the county.
Yes.
That is FIF. They did a revenue share model with the person who installed the equipment.
That's okay. As
So
long as whatever is due is remaining in the facility.
And soon I told these CEOs of mine, I will stop paying the doctors and nurses. They must take over that payroll. So we are seeing the growth of these hospitals. These hospitals can actually stand on their own. Once SHA is fully, the reimbursement is guaranteed on time, we can be able to move all of this stuff to the payroll of the hospitals so that we can have, them as almost level 6, but not in terms of speciality, but in terms of autonomy. So CEO, whatever I might have left out, kindly.
Chair.
Why don't we allow the CEO to finish what we can
Okay.
you, Excellency. I think, Chair, Honorable Senators, I have nothing to add. His Excellency has addressed everything.
Chair.
When I see you, that's a joke of the year. Now, there are only two specific areas the governor has touched on. I expected you to tell us something about the issue of audits, whether your facility has been audited. Do you have any report? I also expected you to tell us that now that this revenue is coming, how are you utilizing?
Thank you, Honorable Chair.
And on the issue of, I don't want us to wish it away, Governor. On this issue of allegation of malpractice, I think you must speak to it, Pana CEO. It cannot just be, you know, Senator Okiya Mtata is not an ordinary man. And you know he's a lawyer who is not trained. And he does extensive research. By the time you see a statement, just know there is information. So I think clarify whether there have been such incidences before they have been dealt with and what is the position. I think that one line sentence is not sufficient.
Honorable Chair, well guided. On alleged abuse of the medical facility, the response is false, it's not true. There are controls to ensure accountability in the process. And to achieve this, Honorable Chair, is that the medical facility is managed by a standing hospital committee, which comprises 1, medical social work in charge, the ward in charges, these are the nurse managers, the overall nursing services manager, the hospital administrative officer, and the hospital accountant. Honorable Chair, Honorable Senators, the beneficiaries of this facility are identified among both outpatients and inpatients, and mainly include patients not registered with SHA, street families, gender-based violence victims, patients without social support, mostly from slums, and the wrong state discharged patients. Honorable Chair, Honorable Senators, the nature of these waivers are in 2 categories, namely full waivers and partial waivers. Roman 1, full waivers. These are patients who cannot raise any amount to offset hospital bills. Roman 2, patient waivers, partial waivers. These are patients' bills partly paid by SHA but cannot raise a balance, or the patient or the guardian able to raise a percentage of the hospital bill. In this case, a favorable amount is paid directly to the hospital account and an official receipt is raised and the remainder of the bill is waived. In both instances above, Honorable Chair, the committee determines the applicable criteria through a vetting process in partnership with relevant community health promoters, area administrators, mainly chiefs, religious leaders, and political leaders, mostly area MPs and MCAs. Once the waiver committee makes a determination on either of the above, an official waiver form is issued to the beneficiary bearing patient's information, signatures which imply approvals of the committee membership, and a record of the beneficiaries is filed and kept by the Hospital Medical Social Work Department. After the management executes this process, it is subjected to the Hospital Board of Management on quarterly basis for audit of the process and ratification. Question 2. The veracity of allegations of threat and intimidation against the staff. Response. The allegations are false. The hospital has an anonymous incident reporting system that guarantees the safety and protection of whistleblowers. And this is addressed by a committee who opens the boxes and analyzes issues raised. Question 3, Honorable Chair, Honorable Senators. An audit of collection.
The department, let us not go far. Waziri, how many times has your department audited your facilities? When was Mbagathi last audited?
We audited Mbagathi last year, that is the year 2020, 2024-2025. The audit is currently going on. We submitted the 2023-2024 to the county assembly as well, so it's audited annually.
Thank you very much. Senator Onyonka.
Chair, thank you. I just have two small issues. The MD of Mbagathi Hospital, I don't know whether it's, yes. I wanted to say that thank you. Chair, I've had cases of my people from Kisii who have been having challenges with the treatment of certain diseases, and it's been extremely very welcoming. And I've also seen your facility, two recommendations, and Governor is here. Governor, I've noticed that many of the projects we do, either as a country or as a people, we never keep any maintenance money or maintenance teams to clean up the facilities and keep on repairing them as we use them. I don't know what you are going to do about that. And the final one, I sit in the Finance Committee, and one of the recommendations that was given is that we need to have internal auditors in all these facilities that you're running, who will be having frequent audits in order to try and manage and control the use and the management of your facilities. Otherwise, Chair, thank you so much.
Before you respond, Madam CEO, I've looked at the revenue sharing agreement for parking. We are only getting 30%. Why? And for how long? When is the revenue sharing going to be 50-50? 30% is on the lower side.
Thank you, Honorable Chair.
Let's Senator Kamau, so that you can respond to all of them. Senator Kamau.
Yes, thank you very much, Chair. I wanted to ask the Governor, now that we are in the process of encouraging people to register for SHA, I just wanted to know what is the number of registration of Nairobi County, the people that have registered on SHA.
You can respond.
Thank you, Chair. As I get that number, the CEO has mentioned, and the question that has been asked about the quality of the service. I'm glad the Senator Onyonka's people go to Mbagathi. I want to tell you, Chair, I myself have been treated there, and my father goes for physiotherapy there. It is at the same level as any other hospital you'd go to in this capital of Nairobi, whether it is the private ones which have been known for a long time. The level of quality I got there. In fact, the doctor who saw me, what was his name?
Dr. Masini.
He is one of the best, you know. His specialty is in orthopedics.
Orthopedics.
He's in orthopedics. I had an issue where I fell from a motorbike. But, and don't ask me the context. But, because I ride bikes. He treated me so well that I've kept going. My dad does his physiotherapy there regularly. He leaves Kitale, comes to Nairobi, straight to Mbagathi. And he says he doesn't want to go to the other hospitals I used to take him to. And we need to encourage that use of our public facilities, especially by public officers. Because the same quality I expect my person from, Kibra, which is next to Mbagathi, of medical care to get the same quality that I should be able to get for myself and for my children. Now, the problem with the children, they're not ours alone, they are mothers, and their mothers have their preference. But it was up to me, even my kids would go where I go to, because I'm a patient at Mbagathi, I have it over there, and at least I have my personal doctor. Chair, the issue of maintenance is important, which is why, and now we're moving to the level 4s. The introduction of CEOs in level 5. A CEO looks at the 360 degree of a hospital. From how does the gate look like? How is the signboard? How does a watchman speak to mwananchi when he comes in there? Are they welcoming? Is there a reception? Is there signage that shows you directional mapping? Doctors are good, but they focus more on medical and clinical and technical issues. So that has helped us do some, well maintenance. If you come to those hospitals, you will see the gardens are taken care of. The quality of paint, the aesthetic, even the aesthetic value, the food, they look at what, the patients are getting, etc. And we've seen huge improvement. And now at the level 4s, we are soon advertising for also those facility heads of that nature that can look widely. Because our level 4s have realized in Nairobi almost like a level 5 elsewhere, because of the sheer number of people that they see. So that is what we intend to do.
Thank you, Your Excellency. Honorable Chair, the sharing formula was determined after several considerations. We sat down with the FEDA and we also worked on his return on investment. and we have transferred some risk to him, like other than the installation of the machine, he is doing the maintenance of the equipment, including updating of relevant software and other physical infrastructure, ensuring the parking area is clean, and such other things. So it will subsist for a period of 3 years, then we'll do a review. Honorable Chair, thank you.
Thank you very much. At least the period is fairly good. So, Senator Kamau, there is only one more question that asked about how many people are registered in SHA in Nairobi.
Oh, yes. On SHA, we have 2.9 million people now registered in Nairobi. That is 42%. And so we keep telling them, star 147 hash, register, join SHA. Even the short code has the county number of Nairobi, 47. So we are the biggest champion because it's really helped our facilities, especially at the primary level. Chair, just as a by the way, or maybe as a diversion, when we are here, people are watching us, and somebody has sent me a message asking for money to go for radiotherapy at a private hospital. I want to tell him he's called Tobias, go to Mbagathi, and you will receive that service the same way we're being treated there. I've just seen that message on my SMS, Chair. Chair, we humbly submit.
Thank you very much. Maybe, honorable members, if there is anything else other than what was on the statements. So thank you very much, Governor. The last time we made a visit to Mbagathi and the Nairobi funeral home, and the funeral home was not in a good state. All the generators were not working, all the fridges were not working, so I hope there is improvement.
Chair, in fact, one of the issues we had asked was, Governor, I hope you've solarized all your health facilities.
Not all of them. Solar is expensive, so we're looking for partners. The initial cost of setting it up is a bit high. So we've been able to do some markets. We are looking at the facilities if we can do through FIF, because we don't want to pump in more money in hospitals while they're actually receiving money. The markets don't receive money, that is comparable.
So I was just saying, Governor, when we visited the Nairobi funeral home, there was a huge problem. So maybe just in a nutshell, tell us the improvements we have done. We noted that the generator was not working, the fridges were not working. We had also issues of staffing in that place, and I'm happy now that KMTC is now training mortician. One of the problems that we had was it has to be training on the job. But now KMTC is training personnel, so I don't know whether you have improved the number of personnel. The few are there were complaining about the workload. And the other thing that was a problem in Nairobi Funeral Home are unclaimed bodies, and also bodies that are brought by the police. And I actually made a recommendation that there is need to have a separate problem mortuary because of the nature of Nairobi and the issues of crime and all these unclaimed bodies. It is completely necessary to have a separate mortuary to handle issues of police, because the bodies are kept there for years and before the matters are concluded, and if they are mixed with the regular bodies where families come to take, those staff there specifically made that request that their work would be made easier if they are dealing, with the issue of normal bodies from facility and so forth. But the ones that have police issues should actually be kept in a separate place. So maybe you can just make that. But I just want to say thank you very much for. Yes, Senator Mida.
Just a second, just one question. I was just wondering on mental health. Do the morticians and maybe all the people that handle these bodies, are they taken through mental health? I mean, are they taken through counseling and all that? And one last thing, it is really important. But one last thing is that about medical equipment. I hope all equipments, working at this time. The medical equipment is quite thorny. It, Gaba. Thanks.
And I encourage all of us who are here, for purpose of mental fitness, it's good to once in a year you visit a mortuary. It wakes up. It will help you wake up to the reality that do something when you are still alive, because.
Chair, when you see my CEC who's next to me, who is the youngest CC in this country. When she became CC for health, I told her the first thing she must walk through the city mortuary from one end to the other end. And she was at first timid but became very bold. Even I got used to it. I think I've gone there more than any other leader in this city before. And I keep going. If I pass by Bagati, I always pass by the funeral home. I know those young ladies who you met. At that time there were 14 of them. We've onboarded them. They have come on board. We've hired also some casuals. Senator Hamida, politicians love their job and they really enjoy their clients. Their clients are not rude. The clients don't complain. They don't talk back. If you ask doctors, the chairman of Nairobi Funeral Home is Dr. Johansen Odo, who is one of the highly acclaimed morticians in our country. And if he tells you stories of what he's dealt with, it's a calling. You know, when I was in Chiromo in campus, the medical school students would also start in Chiromo and our school of math. And in first year, many would drop out because they start with pathology, where you have to go work on the cadavers. By the time you've gone through that and you end up working in the funeral home, it is something that you're good with. But I hear you. If actually for all our staff, wellness is available for them. It is in the insurance cover. We encourage them, and we have our own county councillors. One thing we realized was many counties, and it's something we dealt with when I was here as chair of labor. Many counties didn't have in their schemes of service provisions for clinical psychologists, psychiatrists to be hired. So many counties didn't have that component. We changed that, and even as Nairobi, we've had very many, counselors, psychiatrists. In our facilities, you find that service available. And I want to encourage senators here and colleagues, because Chair, in the first time I was here in 2013 as an MP, we didn't have that in our medical scheme until one of our colleagues had an issue. And when she had this issue, she stormed the speaker's office and said, why is it that my psychiatrists cannot be paid? Because they are not on insurance. When that was introduced, it became the highest sought service by parliamentarians. So I hope you're also taking it, because it is okay not to be okay. And we did that book last year with them in the last Senate with Senator Sylvia Kasanga about mental health. Chair, on the issue of Nairobi Funeral Home, by the time we went there, there had been a challenge with the coolers. We've increased the number of coolers. There are 10 new coolers in Nairobi Funeral Home. The issue of disposing bodies has to go through a court process. We have to go to the courts to allow us, and we put the list in the paper. It's very expensive. But in the last financial year, we've been able to dispose 1,000 bodies from Nairobi Funeral Home. I really like the idea that you've given, that a special facility be set up purely for those cases that are from crime or police cases, etc., because they're treated differently. And that's a conversation we can have, because it reached a point that my chief officer refused to receive bodies from the police, and now the bodies were kept in a truck. Now the police boss tells me he has no mortuary. What does he do? Because they don't pay. For all other people, there's a payment that is done. But for the cases that come from the Kenya police, they do not pay. And so we said, let's find an arrangement between ourselves and the national police, because they don't provide such health services, but they can help us construct, or we can construct a facility that those cases can be dealt with in the manner they're dealt with. And I want to thank you for that idea. The issue of medical equipment is something we chose as a city, as a county, not to rush into it. There's a national equipment program, which is a good initiative. We had earlier the MESS program, which became a mess. So 45 counties signed. Nairobi didn't sign, and Kiambu had not signed, because we wanted to look at the detail of each contract and what we were already receiving. In some of the instances, we had better deals in terms of the revenue share of placement. We have since been able to negotiate. And so what we are signing as Nairobi, and I have already authorized for us now to sign, is a specific tailor-made program based on what Nairobi needs. so that you don't sign for what you don't require. Remember, there are countries that had signed, they were being charged, the money was being withdrawn from COP, yet they don't have three-phase electricity. So they're not using equipment that they're paying for, or they don't have water connections. So just being prudent and making sure that we get value for money. It has taken us time to refine all of those contracts into our tailor-made requirement. You'll find there are certain machines that are needed in Islands, maybe near Dandora. You'll find more respiratory issues than in Dagoretti. There are certain issues that are actually, in as much as Nairobi is small, there are very different ailments. Mbagathi has a huge population of people coming from Kajiado that come to Kajiado County, that come to Mbagathi, and what they come for is very different from what people are being treated for in Roysambu. So in fact, that's why I have found land to construct a proper level 5 along Magadi Road. So the Ongatarongai population, which I still consider my population really, because they're here throughout the day, they just go there to sleep, can also have a fully fledged level 5 facility along Magadi Road, just after the Catholic University. So Chair, yes, these improvements are being made day by day. We are not yet there. We are not perfect, and no county is, nobody is. But I'm very proud of what this team has been able to do. I'm proud of my team. And whenever they have challenges, they come and they consult. We've made great strides. I think the ICU example was a very stark comparison. From zero to the numbers that we have, we need more. But we will put together a proposal, Chair, that I will present to your committee on the affirmative action that Nairobi needs with respect to healthcare. And I'm sure that you'll be able to support us. Thank you, Chair.
Thank you very much, ladies and gentlemen. I think we stop at that. So this meeting stands adjourned. We shall be visiting, definitely. And Governor, most of the time for purpose of Nairobi, because we are all usual residents of Nairobi, sometimes the requirement of notice is not necessary, because it's about service delivery. So we shall be making quite several impromptu visits to your facilities. And our work is to give feedback on what needs to be done to where. So just take note. Mbagathi, of course, no, Mama Lucy, from the last report we had asked you to take some, the recommendations we had made. So we are also coming there to check whether you act on our recommendations. And that entirely lies on the facility and the boats. Otherwise, ladies and gentlemen, thank you very much.
Yeah, the only issue of notice is not for time, but so that you have the right people. Nairobians, you can find someone and he says he's the CEO, yet he is there for mental health issues. And he takes you around and gives you a report. So just so that you have the right people in the right hospitals, just tell us, even if it's one day.
No, we shall tell you, but it will be part of mental treatment. That walking around will also be a way of relieving pressure. Asanteni sana.